Next. Presenters, time allotted is 10 minutes, okay? 8 minutes, one bell will ring, and after another 2 minutes, second bell will ring, okay? Within 10 minutes, you have to complete your session. And best paper award will be given in the valedictory program. Assessment criteria. Next. The assessment criteria is timely completion of presentation, scientific relevance of the topic, scientific methodology, clarity of presentation, elements of new knowledge. So now I call upon Dr. Naga Sujana to present her paper.
Good afternoon, everybody. Respected dignitaries. This is Dr. B. Nagasrujana, Department of Panchkarma. Next slide. And my topic is, previous. The multidimensional therapeutic applications of Upanaha Sweda. Introduction. Upanaha is one of the Sweda karma that is usually performed before the administration of the Shodhana procedures. So it also plays a key role like as Pradhana karma. And it is derived from two syllables like Upa and Naha. Upa, that means nearer, and Naha means bandhana or tie or any bind. Upanaha is neither too hot nor too mild, administered with suitable drugs and applied as per the condition of the affected part of the body. Based on the assessment of Vata and Kapha, domination of Vata or Kapha, the drugs are changed. And materials and methods. Upanaha is the indicator of bandhana. However, in practical sense, it is performed under the three methods like bandhana, potalisveda, and lepa. Bandhana is not much difference between bandhana, potalisveda, and lepa, but bandhana and lepa, there is a difference between in thickness. So, paste of the Vatahara drugs is slightly heated and applied over the affected part and covered with Vatahara leaves like Eranda and Arka and keep for 10 to 12 hours. And next, Potalisveda, it is slightly warmed with Vatahara Thaila and made into Potali and used as local fermentation. And Lepa, it is made like paste and applied on the affected part. It is only for 4 to 5 hours. And indications and contraindications, general indications like Vata Vyadhi, like Janu Sandhigata Vata, Pakshagata, and Akshirogas like Alasi, Puyalasa, Arbuda, Gudarogas like Arshas and Bagandhara, and other conditions like previously. Indications. Vrana, Vidradi, Granthi and all other rogas. Sankuchayamana, it is mentioned in Sushruta Sutra. And contraindications are Pitta Avarana conditions. And generally, Upanaha made by Charaka Sutra, Goduma Shakalas Churna, Durmai Yavana, Amla Samyukte, Sasneha Kinva Lavane Upanaha Prashasyate. This is the generally we apply as Upanaha according to Charaka Sutra Sthana. And this is comprehensive research of the Samhita for Upanaha drugs. These are the drugs which I have enlisted from all the Samhitas. And method of performing bandhana form of Upanaha. These are all the material which are used for Upanaha like medicinal powders, bandage cloth, leaves, and Amla Dravya, oils, Saindavan, one attendant. And this is the preparation. Medicine with or without heating. As we know, Upanaha is done Sagni and Niragni also. So, it is made, the Upanaha is made into a paste either with Churna, Saindava Taila and Amla Dravya and made into, make them heat as per the temperature, and it should be tolerated by the person who is to be keeping. Next. And the procedure is patient should be in comfortable position and exposing the joint or body part. The area should be clean and Abhyanga should be done before Upanaha Sweda as it is Snehana. And then applied the prepared Upanaha Dravya. Thickness is 1 to 2 centimeters by slightly warming. Next slide, sir. And it should be bandaged with a soft piece of leather cloth. If leather cloth is not available, we can use any cotton. So before that, we should keep the Vatahara leaves like Arka or Eranda, and leaves of next slide. And precautions should be taken that it is neither too tight or too loose, and it should be consistency, and it should not applied on the wounds because pitta is contraindicate. And next slide. And based on the quality of the drugs, Sita Upanaha, Ruksha Upanaha, and Snigdha Upanaha, and these are the drugs for Sita, Chandana, Ushira, Sariba, Manjishta, Estimadu, and Nimba. These are practically we have done. And for Ruksha, Kola, Kuluttadi. And for Snigdha, Dashmula, Shatavari, Kulutta, Badara, Masha, Tila, and Rasna. And these are mentioned in Samhitas, Jivaniya Upanaha, Jivanti, Shatapushpa, Bala, Madhuka, Vacha, Veshwara, Gruta, Taila, Vasa, and Majja. And Mahasalavana is mentioned, Dashamula, Shatavari, Kulutta, Badara, Masha, Tila, Rasna. This is Stambhana. And these are the practically used Upanahas. And benefits of Upanaha. Benefits, as we know that it is especially Upanaha Sveda Vatagna, it is mentioned by Sushrita Samhita, and we can use this Upanaha Sveda for Vata and Kapha conditions mainly, as dosha is predominant, and it relieves localized pain, swelling, and inflammation, and promotes better circulation by removing stagnant blood, fluids, and toxins from the injured area, and improves muscle flexibility and joint mobility, and it is recommended for strains and sprains also. And probable mode of action is the lipodyl bond is suitable for the penetration of the drug molecule. Oil helps in penetration, and it forms the lipodyl bond with other drugs, thus helps in the penetration of the drug molecules. And it is a type of Swedana, it is a hyperthermia, thus improves the local blood circulation and lymphatic circulation, thus reduces inflammation by modifying secretion of various inflammatory mediators, and it relaxes the local musculature by physical effect of heat. Next slide. And conclusion, like relieving pain and stiffness, improves physical status of the patient, and produces the desired effect based on the dravya selected for use, and local vasodilation, and increases the blood flow. Thank you.
Thank you, Dr. Nagasrujana. Now I call upon Dr. Sachin Chandra sir to present his paper.
Respected chair and co-chair, respected my teachers, Dr. Johar sir, Dr. Praveen sir, all the doctors and the participants, and above all the organizers. Very happy to see all the organizers. Thank you very much. Okay, I am Dr. Sachin Chandra. I am pursuing my post-graduation in the Department of Panchakarma at Dr. BRKR Government Ayurvedic College, Hyderabad. And now the presentation of today's time is a gist of research activities at the Department of Panchakarma at BRKR Government Ayurvedic College, Hyderabad. Okay, introduction. Dr. BRKR Ayurvedic College is one of the very few Ayurvedic institutions across the country having a reputation of being established before independence. It has been recognized as a model institution for all services. It has 7 postgraduate, and latest being the Department of Panchakarma, which has come into existence in the year 2008. Department of Panchakarma at BRKR Ayurvedic College has been contributing enormously to both academic patient care and research since its inception. It is quite evident when we check the census related to the robust growth in the both IPD, OPD, services rendered to the patients at BRKR Government Ayurvedic Hospital. The research activities carried out at Panchakarma unit are focusing on both therapy-related studies as well as establishing the significance of Chikitsa Sutra as a whole in the disease management. So the purpose of the study is to consolidate the research and the patient care-related activities carried out at the Department of Panchakarma at BRKR Government Ayurvedic College and its attached hospital with its focus area. Then what's Panchakarma? So everybody knows Panchakarma, but Panchakarma presents a unique approach of Ayurveda with specially designed 5 procedures of internal biopurification of the body through gross channels like GI tract, respiratory tract, etc. up to the subtlest levels. Such a purification permits the biological system to return to normalcy and to rejuvenate spinal spontaneously and also facilitate the desired pharmacokinetic effect of curative remedies administered thereafter. Panchakarma eliminates toxins and stagnated malas and metabolites from the body, cleans and the micro and macro channels, maximizes the absorption and metabolism of nutrients and drugs, and helps in minimizing their dose and toxicity. Panchakarma therapy is not only a prerequisite for all of the therapeutic procedures and medication, but also has a full therapeutic role as a promotive, preventive, curative, and rehabilitative procedures of disease and health. Priorly, Dr. Perumal has already said about assimilation of all systems of medicine, and how far we are able to take Panchakarma in that assimilation depends upon the torch bearers. Next. No medical system has a similar theory, and the Panchakarma is very unique in that minimal or no recurrence is seen while we go for Panchakarma therapies. Disease-wise, it is eliminative and suppressive, and eliminative type of approach is through Panchakarma, which everybody knows it, and ability to treat potentially all the chronic ailments, purification of the body and mind for healthy and the diseased. Panchakarma can be used. Methods adopted. The total number of theses submitted has been enlisted. Progress in the OP and IP in the department has been documented. Total number of therapies provided to the patient is documented. Focus area of works have been identified. Focus area of research in Department of Panchakarma: asthma and allergy, arthritis and allied conditions, skin diseases, CNS degenerative disorders, diabetes, disorders of fertility, chronic headaches, hypertension, obesity and lipid disorders, residual paralysis, stress and residual psychosis, healthy aging and rehabilitative. Results. Number of clinical trials conducted in the Panchakarma department. The search yielded about 71 trials in the department, and in the year 2016 we had lost one batch, so it is somewhat 71 like. Characteristics of registered clinical trials. Majority of clinical trials were conducted on patients. A total of 71 were done for postgraduate thesis studies, where the most common conditions for which trials were conducted are Sandhigata Vata, the number is beside that 7, Gridrasi Vata 5, Kitabakusta 4, Medoroga 3, Vishwachi 3, Kalitya 3, Pakshagata 2, Amavata 2, Vatarakta 2, Kshina Shukra 2, Nidranasha 2, Ardhita Vata 2, Manyastamba 2, and Vangya 2. And the Chikitsa, the complete Chikitsa Sutra related works were done on Amavata, Sandhigata Vata, Pakshagata, Manyastamba and Gridrasi. So this is the worked out treatment protocols for hemiplegia. The treatment protocol is Abhyangana, Salvana, Upna, Virechana, Matravasti, Shirodhara, Shirovasti, Yogavasti, Nasya. Similarly, rheumatoid arthritis, Deepana Pachana, Langana Valuka Sweda, Churna Pinda Sweda, Matra Vasti, Vaitrana Vasti, Siddha Vasti, Sciatica, Abhyangana Patra Potali, Sweda, Kativasti, Upanaha, Virechana, Matra Vasti, Psoriasis, Snehapana, Lepas, Vamana, Virechana, Takradara, Jalokavacharana. And osteoarthritis, Abhyangana, Januvasti, Janudhara, Patrapotali, Sweda, Upanaha, Matra Vasti, Jalokavacharana. The durations is for 60 days, 45 days, and 60 days respectively. The goal of the therapy in hemiplegia, it is improving the gait, mobility, muscle tone, grip power and speech. And in rheumatoid arthritis, the goal of the therapy is stopping analgesics, preventing disease progression. In sciatica, the same way, avoiding analgesics and preventing the surgery. In psoriasis, avoiding the steroids, dietary corrections and reducing the relapses. And in osteoarthritis, avoiding excessive intake of calcium tablets, analgesics, reducing pain and avoiding surgery. And we are doing very nicely and we are progressing at a very good pace in that field of osteoarthritis, where we have got registered cases in which we have stopped surgeries, and the patient himself has come back from not getting surgery. This is the outpatient services for the month from the June 2022 to 2023 overall. And if we take a look at it, it is somewhere around 1300, 1400 to 1800 is the normal OP of a Panchakarma department in BRKR GH. And the OP services in we see in the month of May, it was about 1869 complete. And the inpatient services, the total number of beds allocated to the Department of Panchakarma are 61, and usually we feel we are more than that, except for 2 months in the month of November and December 22. And the IP services in the Department of Panchakarma. Next. Therapy censuses. These are the number of therapy procedures performed from June to May. Next. Next. So this is a list of Pura Karmas conducted in the Department of Panchakarma, starting from Abhyangana, Tailadhara, Kashayadhara, Meru Vastis, Nimodara Vastis. Next. So there are total 38 Pura Karmas that are being done here. And the various types of Vasti Karmas performed are around 26. Next. This is Abhyangana, downward movement and all those things. Next. Next slide. Udvartana. And we are doing Udvartana in obesity, and we are having a very good response in it. And Shirodhara, this is disc herniation, and we coming out with Kativasti in this. We have got very good responses. Grivavasti in cervical spondylosis, Merovasti, completing. And we have got a case, we are already we have done it in ankylosing spondylitis. And Janvasti, and this is Shirovasti. And we are working a lot over Shirovasti, Akshitarpana, Gandusha Kavala. And the steam therapies, there is Svedana. And next, this is Nadi Sveda, Valuka Sveda, Sarvanga Sveda, Upanaha Sveda, Shashti Salika Pinda Sveda, Kukutanda Nimbus Sveda, and the Foi Shodhana therapies. Next, coming to Vamana. And this Vamana Karma is done at our hospital under the supervision of the PG students as well as the faculty. And Virechana also is done to the inpatients under our supervision. Next. And this is Vasti Karma, and probably you will have to this Kashaya Vasti, and more representations in this regard will come. Anuvasana Vasti, indications and neurological degenerative disorders. Nasya Karma, administration of Nasya Karma also we are having a very, very clear cut and demarcated way of doing it, and you will have a presentation in that regard also further. And this is the Rakta Mokshana where we are doing it. Okay, conclusion. The Department of Panchakarma has been very progressive unit of BRKR GSC. There has been a phenomenal growth in the OP, IP and therapy related services extended to the department. Research on therapy protocols have been encouraging. Okay, thank you.
Presenter paper.
A very good afternoon to all the dignitaries in the hall. I'd like to present my topic, Clinical and Scientific Perspective of Brahman Nasya, guided by Dr. Praveen Kumar sir and Dr. B. Johar sir. So as we all know that Aushadam Aushasda Sneham Vanaskam Dietit Nasim, the process of installation of the medicated drug or oils through the nostrils is considered as Nasya. These are some of the synonyms of Nasya, like Navana, Shirovirechana, Murda Virechana. So classification according to Charaka, and according to mode of action, it is of 3 types: Rechana, Tarpanam, Shavana. According to method of administration, there Navana, Apidan, Bapana, Pradmana, Duman, Nasya, Pratimarsha. According to Shishrit, it is of 5 types: Shirovirechana, Pradmana, Apidana, Nasya and Pratimarsha. So according to Vagbata, Virechana, Brahmana and Shavana. According to Kashyapa, it is Brahmana and Karshana. The time of administration, according to Dosha, in Kapha Doshas, we will give in Pratakala, in Madhyana in Pitta, in Sayankala and Ilaha. According to seasons, it is Purvani in Sharad and Vasanta, in Madhyana in Hemant and Shishira, Sayankala in Grishma Rutu and Satapa in Vasharitu. So according to diseases, in Vata Shiroroga, Apatanaka, Swarabramsha, Hidma, Ayama, you will give in morning and evening session. In Lala Srava, Supti, Pralapa, Puti Mukha, etc. will give in night. According to the dosage, Snehana Nasya in Hasva Matra will give in 8 bindu and Madhya Matra 16, Avta Matra is 32 bindu. According to Shodhana Nasya 4 bindu, 6 bindu, 8 bindu. So Marsha and Pratimarsha, Marsha is 6 bindu, 8 bindu and 10 bindu in Hasva and Madhya and Uttama Matra. So in Pratimarsha it is 2 bindu. Next please. So coming to the concept of Brahmana Nasya, The word Brahmanam means nourishment. So the substance which consists of the properties like Guru, Shita, Mrudu, Bahula, Stula, Pichila, Manda, Stira, Slakshana can exhibit the Brahmana effect. So Brahmana Nasya by Vagbata, Tarpana Nasya by Charaka, and Snehana Nasya by Shushruta are considered synonyms to each other. So Brahmana Nasya gives nourishment to the Shiro Indriyas, eliminate the vitiated with Vata and Pitta doshas. So it is considered as a Dhatu Poshaka. So some of the examples are Snehadravas, Jangal, Mamsrasa, gums and resins can be used in Brahmana Nasya procedures. So Navana and Tarpana has Brahmana Nasya. Shushruta used the word Nasya for Navana Nasya. So both in Brahmana and Navana, Snehadravyas are being used, exhibiting the similar effect. So it is effective in Shiro Shunat, gives strength to Uttamanga and having a long lasting effect. The major difference is the Brahmana Nasya is characterized based on action and Navana Nasya by administration. So Marsha and Pratimarsha has Brahmana. Marsha Nasya is Shodhana, Shamana and Brahmana. It is Ashukari, indicated in Bahudosha and Madhyama Avastha dosha, indicated in Dhruva Sharila Bara. In Pratimarsha Nasya, it is Shamana and Brahmana, Chirakari, indicated in Alpa dosha, indicated in Sukumara persons. So 1 bindu is equals to 8 to 10 drops, that is equals to 0.5 ml. Here 1 bindu means a quantity of liquid which falls dipping of 2 phalanges of Pradarshini, that is index finger. So these are some of the indications of Brahmana Nasya. According to Vagbata, Brahmana Nasya is given in Vata Shula, Surya Varta, Swarakshaya, Nasasya Shosha, Vaksanga, etc. And according to Charaka, it is given in Shirakampa, Ardita. And according to Shushruta, it is given in Shunya Shirasam, Griva Skanda Rusamcha. It is Bala Jananarda, Dushtu Prasada Jananarda. It is given in Timira, Swarupagata, Nasa Roga, Asasya Shosha and Avabahuka. It can cure Akalaja, Valita Palita, Dharna Prabhotaga and Vata Pitta Mukarogas. So Brahmana Nasya Yogas. Anutala can be given in Shirashula, Karnashula and Manyashula. Kshirabala Tala or Dhanvantri Talas can be given in Manyagata Vata, Ardita, Shirashula and Avabahuka. Karpasyadi Tala can be given in Ardita Vata, Grita can be given in Hikanshvasa. So Thaila having the Sukshma, Ushna and Tikshna properties enters into the tissues and thus absorption of the transportation of the drug occurs. So according to mode of action, after installing the drops in the nose, it enters into Shrungataka Shrotas and reaches the Murda and Siramuka of Netra, Karna and Kanta. So here Shrungataka means the meeting or the doorway of 4 pathways is Shrungataka. Shrungatakam Bhave Dware Kantake Va Chatushpate. Thus Dravya enters into the Shiras, give nourishment to Shiro Indriyas, eliminate the morbid doshas. Remembering the Shushru's caution that excessive administration of Virachana Nasya may cause oozing of the Mastulinga, that is CSF. Here he is explaining the lymphatic pathway of the lymphatic pathway. So CSF is a clear fluid which is derived from the choroid plexus, which is otherwise derived from the tena cordia, that is nothing but the tuft of capillaries. So often from the lateral ventricle it enters to the third ventricle and to the fourth ventricle and enters to the central canal of spinal cord. So after entering the central canal of spinal cord, from the median aperture it goes to the subarachnoid space. From the subarachnoid granulations it enters into the superior sagittal sinus. So next. So neural pathway, ponton medullary junction. The cranial nerves originate from the ventral area of the pons, that is cranial 5, 6, 7 and 8. So the recalling Sushruta's opinion, the Shrungataka Shrotas is a union of Shrotas of Jiva, Grana, Netra and Shrotra. So vascular pathway, the vascular transportation possible through pooling of the nasal venous blood to the facial veins. Here the inferior ophthalmic veins and the facial veins doesn't have any valves. So blood from the facial vein can enter into the cavernous sinus. So in this way, the morbid doshas can expel from the brain. So the olfactory pathway, the nerve cells of olfactory epithelium project into the olfactory bulb of the brain, so having the direct connection between the brain and the external environment. So the drugs to the brain from blood circulation normally hindered by the blood-brain barrier, as you all know that. So which is virtually impermeable to the passive diffusion of all, but small lipophilic substances can. So generally the oils are lipophilic in nature. So oils can enter into the brain, passing the blood-brain barrier. Next. So conclusion, Brahman Nasya can be significant role in neurodegenerative disorders like cerebral ataxia, Parkinsonism disease, cerebral atrophy, provides strength to the neck, shoulders and prevent to roll to plane, cervical spondylitis. Here the occupational diseases such as graviaceous, today's generation is mostly of night shifts and other things. So thus Brahman Nasya prevents occurrence and prevalence of the disease. So Brahman Nasya helps in enhancing the memory, cognition in both children and adults, then enhancing the overall effect of an individual. Thank you.
Thank you. Now I call upon Uma Mantha to present her paper.
A very good afternoon to one and all. I am Dr. M. Uma, final year PG scholar, Department of Panchakarma, Dr. BRKR Government Ayurvedic College. Today's my topic is a conceptual analysis and importance of Kalkadravya in preparation of Niruha Vasti. Vasti is one among the important therapy, Panchakarma therapy, which is considered as Chikitsartha. It is possessed with multidimensional action. It is important. Niruha Vasti is a mixture of Makshika, Lavana, Sneha, Kalka and Vata, and it is important to know the rationality behind the mixing of Vasti ingredients before administration of Vasti to the patients. The ingredients are immiscible with each other. A homogeneous mixture is required for actual administration of Vasti. The homogeneity needs to be sustained for a reasonable period through the procedure of administration of Vasti. Kalkadravya acts as a catalyst agent which improves the potency of the Vasti. The emulsion nature of the Vasti Dravya has got a cleansing, healing effect. It has got multi-dimensional therapeutic effect. Dravyam Ardham, the definition of Kalka is Dravyam Ardham, the green drug converted into paste by Shilapishtam, by rubbing it on a stone, and when the drug is dry, Shushkam, we add a little water to make a Kalka. Kalka confers Sandhrata to Vasti Dravya and will not change the volume. Kalka helps in retention of enema. Kalka helps in Pratyagamana of Vasti Dravya within a stipulated time. Prevents Ayoga, Atmana and Upadrava. Kalka drug enhances the action of Vata Dravya. Niruha Vasti is a hyperosmotic solution which causes movement of solvent from cells of colon to the lumen containing Vasti Dravya, facilitates the absorption of endotoxin and produce detoxification during elimination. The Kalka, which has got irritant properties along with other ingredients, may induce colonic distension. This distension stimulates pressure which produces evacuatory reflex. Kalkadravya must having the property to act upon the Pakvashaya region and must be acting in the following two possible pathways. One pathway is some of the drugs must be helping in expelling the humors through the anal route due to their Ushna and Tikshna gunas. And some drugs may be decreasing the irritation caused by the Niruha drugs while acting on the Pakvashaya. Example, Estimadu, Bilva and Trivrut. The actual purpose of the study is to understand the importance of Kalkadravya in Niruha Vasti, discussing the rationale of various combinations of Karka that are mentioned in Bruhatrayi and the different Vasti yogas, along with the possible mechanism of Kalka in Niruha Vasti preparation. The Kalka acts like a surfactant. The modern aspect of the Kalka, it acts like a surfactant, helps in the formation of homogeneous emulsion between the hydrophilic and lipophilic substances. Sneha and Kvata helps in disintegrate the malas by increasing the osmotic permeability of the solution. Mustard is one of the best surfactant. Here are the properties of surfactant. Surfactant means surface active agent. Surfactants are compounds that lower the surface tension between two liquids. Surfactants may act as detergents, wetting agents, emulsifiers, foaming agents, and dispersants. Surfactants stir up activity on the surface you are cleaning to help trap dirt and remove it from the surface. Same way, Kalka helps to remove all the morbid doshas from the gut. This is the slide explains surfactant can bind both water and lipids, hydrophilic and lipophilic substances and acts as emulsifying agent. Again, you can see here formation of two layers of lipophilic and hydrophilic substances without adding the surfactant. With adding surfactant, it is mixed homogeneously and acts as emulsifying agent. It's a small experiment of droplet on a leaf surface. With surfactant, it spreads quickly on the surface of the leaf. These are the few observations we have done in our department. Properly prepared Vastudravya will not easily flow off and stick to the palm. It will not form different layers of ingredients added to it, and finally it will form the uniform homogeneous mixture. Kalka helps to prevent to form the different layers. Here is Dashmula Kashaya Nirohasti, prepared with adding kalka and without adding kalka. And the preparation is not following the sequence of mixing. Skip chain. Next. These are the different kalka dravyas mentioned in Bruhatrayi in various Niruhavasti preparations. Skip. And frequency of kalka dravya used in Niruhavasti mentioned in Bruhatrayi. Pippali is first one. Frequency of Pippali is more times, and then comes Shatapushpa, Madanaphala, Estimadu, and Musta and Vacha. Practically, Shatavya is most commonly used drug as kalka in Vasti yogas, and one more Puto Yavanyadi kalka is a universal kalka. Whenever the kalka is not mentioned in the Vasti dravyas, we use Puto Yavanyadi kalka. So Puto Yavanyadi kalka contains Yavani, Phala, Bilva, Kusta, Vacha, Shatahva, and Ghana and Pippali. The Puto Yavanyadi kalka having Vata Kafara properties, Vatanulomana, Malanulomana, and Deepana Pachana, Shrotoshodhana properties. The serial order of mixing of the ingredients mentioned by classic should be maintained to get a homogeneous emulsion. Vasti formulation, a colloidal system, a general but appropriate as it contains Makshika, Lavana, Sneha, Kalka, and Kashaya. Uniform distribution of drugs makes it available to lumen of intestine, which provides maximum absorption. Kalka provides a more viscosity, which helps in long time retention of drugs into the costa. After adding the kalka to the vasti, it forms a colloidal solution. It increases the surface area and accelerates the absorption of vasti. Here is an attempt to understand the importance of kalka dravya in Niruhavasti. Different combinations of kalka are mentioned in Bruhatrayi, in different vasti yogas, and possible mechanism action of kalka in Niruhavasti preparations. Thank you.
To everyone, I am Dr. Priyanka from PG Department of Panchakarma. My topic is Vaitarnavasti and its versatile benefits. Next slides. Basti Chikitsa medicated enema treatment. Basti Chikitsa medicated enema treatment is considered to be the prime modality treatment among the Panchakarma in Ayurveda. It is considered as Ardha Chikitsa, and even physicians consider it as complete treatment due to its vast therapeutic action. It is not only having curative aspects but also promotive and preventive aspects. Various toxins entering our body by food, air get accumulated in our GI tract. As time passes, these toxins tend to increase and get spread in all channels of our body and may cause various diseases. These accumulated toxins in the form of doshas, if expelled at right time, we can prevent the disease. Vaitarnavasti is a form of Niruhavasti. It has unique formulations and special indications. The classical references are available in Chakradatta, Vrindamadava, and Vangasena Samhita. Purpose of this study: to understand the uniqueness of Vaitarnavasti, its ingredients and method of preparation, which is totally different from other conventional Basti preparations. There is also a need to highlight the versatile benefits of Vaitarnavasti, which is practiced nowadays extensively with some exceptional results in diseases like Amavata, Gridrasi, Katu, Uruprushta, Shota, and Shula, Urustamba, Clybia, and Vishamajvara. Ingredients of preparations of Vaitarnavasti according to different acharyas. According to Chakradatta, Phalashukti Karsha, Kudaver, Amla, Guda, Saindava, Janma, Gomutre, Tailayuta Ayam Vastihi, Shula Amavata Haraha, Vaitaranak Sharavasti, Bukte Chapi Pradiyati. Next slides. According to Vangasena, next slides. Ingredients and the quantity of Vaitarnavasti has been explained according to each acharya. That is Saindava, 1 karsha has been explained and it is 12 grams. Guda, 1 shuktika, that is half pala. Amlika is 1 phala, that is 48 grams. Gomutra, 1 kudava, that is 1922 ml, that is not mentioned by Vangasena. Godugdha, 1 kudava, exclusively mentioned by Vangasena. Taila Ishat Taila. Next slide. Method of preparation. Step 1. Initially, 1 shukti of Guda should be taken. In uniform, lukewarm water should be added. In step 2, 1 karsha of Saindav Lavana will be added. In step 3, Tila Taila should be added until homogeneous mixture is prepared. In step 4, Chincha Kalka is added and mixed. In step 5, 1 kudava of Gomutra will be added slowly until uniform Vasidravya is formed. In step 6, finally after filtering, Vasidravya is made lukewarm by keeping it in hot water. Pharmacological properties of ingredients. Rasaguna Virya Vipaka Karma of each ingredient has been mentioned. Rasa Lavana Madura Kashaya Tikta Amla, Guna Snigdha Tikshna Sukshma Kshara Snigdha, Guru Snigdha Guru Ruksha Sara, Virya Shita Nati Shita Ushna, Vipaka of Saindava, Guda and Tilataila is Madura and Amlika is Amla. Karma Shroto Shodaka Tridoshahara, Vata Pitta Nashika, Vrishya Bala Briddhikara, Vata Shamaka Ushna Tikshna, Vyavai Sukshma, Kafa Vatanu Deepana, Basti Shuddhikara. Chemical composition is potassium chloride, sucrose, carbohydrates, proteins, lipids, tartaric, malic and acetic acid. Next slide, sir. Gomutram Katu Tikshnosham Saksharatvanna Vatalam, Lagva Deepanam, Medyam Pitalam Kafa Vatajam, Karma Agni Deepana, Pachana, Bedana and Lekana. Indications: Gulma, Unmada, Kasa, Shota, Ruja, Anaha and Ama. Chemical composition: water 95%, urea 2.4%, minerals and salt enzymes. Next slide. Godugda, Alpabhishanda Gokshire, Guru Sijya Rasayana, Raktapita Shita Maduram Ratapakayo. Properties: Brimhana, Vrishya, Medya, Bhalya, Jeevaniya, Raktapittagna. Indications: Swasa, Kasa, Pandu, Shosha, Gulma, Udara, Amla Pitta, Atisara, Vataroga and Pittaroga Vibandha. Modalities: Astapana, Vamana, Nasya, Lepa, Avagaha, Virechana and Snehana. Next slide. Uniqueness of Vaitarnavasti in terms of its pH. Separate pH of individual ingredients has been mentioned. Saindav Lavana is 3, Guda is 7, Chincha 2 to 3, Gomutra is 9. Overall pH of Vaitarnavasti is 7. Ingredients and their pH according to ingredients has been mentioned. Next slide, sir. Conclusion: Vaitarnavasti has simple combination of medicines and it works by mitigating Vata and Kapha dosha. Vaitarnavasti, due to its specific action on gut microbe, could be primary choice in autoimmune diseases like SLE, RA and scleroderma. Due to its rapid cleaning action, it is beneficial in sciatica lumbar spondylosis. The pH of whole combination of Vaitarnavasti, which is coming around 7, shows the science behind the choice of its ingredients. Specialties of Basti: it can be given after food like Anvasna Basti, but the patient is strong enough, it can be given in empty stomach also. Acharya Vangasena had used the term Vinasha Tashu, indicating the fast acting nature of the combination. Thank you.
Priyanka. Now I call upon Dr. Tripti to present her paper.
All present here. I, Dr. Tripti from All India Institute of Ayurveda, here to present my topic under the title of Role of Traditional Medicine in Enhancement of Endurance of Sports Person under the All India Institute of Ayurveda. These are the content of my presentation. Throughout the presentation, I will talk upon introduction, material, methods, sports in Ayurveda, Kalari medicine and vermology, result and discussion. Introduction: Sports medicine is an interdisciplinary branch of the medicine which focused on the general care of athlete at all level. And the medical and the sports team includes specialty doctors, surgeon, athletes, and physical therapists. The most crucial role of the sports medicine is the prevention, which is the addition of the therapeutic and the rehabilitative approach. So, though Ayurveda, there is no direct description of sports medicine in Ayurveda, but we can correlate it with the various principles that has explained in our classical text. Next slide. Next. Like Ayurveda can play a vital role in enrollment of the sports person for a particular field of sports, like Prakriti Parikshan. Vat Prakriti Purush can be a good athlete rather than Kaf Prakriti athletes, and the Kaf Prakriti person can be a good chess player rather than Vat Prakriti. Likewise, the natural performance enhancement agents that are mentioned in our samhitas like Rasayan therapy, Medhya Dravya
can be used for the enhancement of the mental and physical well-being of a sports person. Likewise, Ahar and Vyayam Shakti regimen that has told in our Samhita can be used as the enhancement agents like Dincharya and Panchkarma, not for the disease but for the maintenance of the physical and mental well-being of a sports person. So Ayurveda has a many highly effective treatment that can be used in the conjunction of with the other therapies or as the primary treatment of many orthopedic issues that athletes face. For the recovery from the surgery, the rehabilitation of an injured muscle or bone and performance level can be speed up with the help of extremely straightforward herbal composition from the Ayurveda. Like these are some studies that has done on sports person with the help of a Ayurvedic drug that shows the miraculous effect of the Ayurvedic drug in enhancement of the Ayurvedic enhancement of the endurance of the sports person, like Ashwagandha, Vidania somniferum and Ashwagandha double-blind clinical study. Next. Now wormology. Wormology is the systematic study of the vital points of the human and animal. The vital points are found on the internal organ, bones, muscle, ligaments, nerve joints and the nerve joints. Important points of the right improper vibration will either improve or worsen the one's health. So wormas are the rhythmically calibrated by the worm professional to treat a variety of alignment including diabetes, arthritis, back pain, nerve issues and more. Next. Type of wormology, there are two kind of wormology, that is medical wormology or defensive wormology. Medical wormology include pressure point, therapeutic massage, herbal medicines, and Marukalam and Thiruvakal Murai are used for the instant relief, and the Thiruval Murai and Thirumal Murai should be done at least for the 3 consecutive days for to get the relief from the Varman related injuries. And the defensive wormology include the Kalari and the Kalari Payatum. Wormology, the wrestler's tapping point can be wrestler's tapping point. If a person can tap on the wrestler's tapping point, get the instant stamina for the particular sports. The Kalari medicine is the traditional form of sports medicine, which were chikitsa were crucial for the survival of the Kalarian soldier in the combat. In addition to the helping them recover from the battle injury, Kalari Chikitsa also helps them perform better, stay healthy, get ready for the conflict. By enhancing the strength and flexibility, Kalari Chikitsa therapy lower the risk of injury. As a result, athlete body are better able to handle the physical demand placed on them, which eventually lead to the improper performance. Like Kalari massage are of 3 types, Kacha Thiramu, Raksha Thiramu and Sukha Thiramu. Kacha Thiramu, this is being done getting for the flexibility and the strength. Raksha Thiramu is for the disease oriented massage, and Sukha Thiramu is for the is for the relaxing of the mind and body. These are the various treatment modalities that is used in the Kalari Chikitsa, that is Marma Khizi, Chavati Thirumul, Kayo Zechil, Taila Lepanam. Marma Khizi includes the Marma with the Kalari herbal oil. This can be correlated with the Ayurvedic Patra Pind Potli Swed. Chavati Thirumul is a foot massage, and Kayo Zechil is the same principle of the Ujichil. It can be correlated with the Abhyang procedure that has explained in the Ayurveda. Taila Lepanam is the application of oil all over the body. Next. Kaya Hujichil concept advanced by the Ayurveda is the same as followed by the Kalari Chikitsa. The Pitta Prakriti people should done light Hujichil, Kafam should moderate Hujichil, Vatam should strict Hujichil, and children and elderly peoples are contraindicated. Chavati Thirumal is a vigorous full body massage that has done with the help of practitioner's foot. The therapist is supported by the rope strung on the roof. This provides the greater flexibility and hence the ease of the movement. Taila Lepnam is a practice apply oil over whole the body, and the oil is applied by the pupils, that is the student of the therapist. Next. The Marma-Khizi technique is a combined with a massage to increase the pain relieving benefit. A Khizi is a poultice that is densely packed with a herbal ingredient heated in warm herbal oil. This can be correlated with the Patra Pinda Potli Swed that has explained in the Ayurveda. this improves the circulation, reduce body stiffness and pain. Marm application, the marm pressure points are vital energy points located throughout the body. When students are trained in attacking the marm in the Kalaripayathum, they simultaneously train with how to tackle with the marm attack. So other treatment in Kalari Chikitsa include the therapeutic oil not described in the Ayurveda, that is the Murivennam oil. And the Murivenna oil is composed of the Indian coral tree beetle leaves. Indian coral tree leaves are used to make the Murivenna, but individual Kalari asanas have their own preference based on the literature. Next. So, Ayurveda can be utilized in a two-way, preventive and the curative. Preventive aspect include the following: Dincharya, Ritucharya, etc. And the curative aspect dealt with the application of various formulation mentioned in the classical text along with the Panchakarma procedure. When compared to the modern medicine, traditional medicine can be performed miraculous on a variety of injuries, including tennis elbow, heel pain, heel spur, and heels for Ayurveda can help with the performance improvement and the achieving physical and mental fitness. Conclusion, Ayurveda treat the patient as a whole and balance the three doshas in the body. Kalari Chikitsa include the act of softly creasing, which can regenerate the veins and arteries, reducing pain. Wormology or Varma therapy shows the instant relief on the various sports injury like the ankle sprain, ankle jerk. This can be used for the minor injury that a sports person dealt with in the particular sports. Next. These are the reference of my presentation that has been collected from the various medical journal or research articles. Next. These are the references from where I have got through the Kalari Chikitsa or Kalari Payathum data. Next. Thank you.
Dr. Sahiti to present her paper.
Good afternoon everyone. Myself Dr. Sahiti, doing post-graduation in Kaya Chikitsa department, and I am from Government Ayurvedic College, Vijayawada. So today my topic is Agni Karma and how it helps in management of Apabahuka. So coming to introduction, Apabahuka in Sushruta Samhita, it is mentioned under Vataja Nanatmaja Vyadis, but it is not actually mentioned under the topic, which is characterized by Shula and Stabdata of the shoulder joint. Charaka used different terms for Apabahuka, heel joint disorder or acromioclavicular joint disorder and rotator cuff disorder. The most important cause is referred pain from any other structures. That is, if a patient is suffering from any other cervical disorder, that nerve compression also leads to frozen shoulder. Next, Nidana. It is mainly of two types, that is Bahya and Abhyantara. Bahya Nidana, it is correlated with any external trauma or fracture, dislocation of the shoulder joint. In Abhyantara Hetu, if a patient continuously takes Vatakara Ahara like Katudikta Kashaya Ahara, it leads to Vata Visheshan in the shoulder joint and leads to Apabahuka. Next, Samprapti. Because of all said above causative factors, Vata Visheshan takes place in shoulder joint and it leads to Apabahuka by causing Marma Abhigata. Next. Samprapti Gatakas, the dosha involved mainly Vata Pradhana, but Kapha is also included. And Dhatus, that is Asti, Majja and Mamsa, Rakta Dhatus are involved. And Srotas involved is Asti and Majjavaha, and Srota Dushti is Sangha. There will be obstruction because of Kapha. Next, Adhisthana is Amsa. Next, cardinal features. That is Bahu Praspandihara. There will be difficulty in the movement of the shoulder joint. Next, Amsa Bandhana Shosha. This will be compared with the degenerative disorder of the shoulder joint. Next, Shula. It is practically seen, but it is not mentioned under text. Next, actual line of treatment is, this is Samanya Chikitsa. That is Nidana Parivarjana. Nidana Parivarjana is the main treatment for any disease. Next, Abhyanga. Abhyanga with any Vatahara Tailas like Mahanarayan Taila, Sahacharadi Taila, it is indicated. Next, Svedana, like Nadi Sveda and Patra Potali Sveda with Eranda Patras. And Snehapana. So, Snehapana is the main treatment for Vata Vyadis. Next, Nasya Karma. It is indicated in Urdhva Jatragata Vyadis. And Shamana Aushadhis like Vatahara Yogas, any Dhanvantri Taila, internal or external application, and Simhanada Gugulu, extra indicated. So this is the core point of the presentation, that is Agni Karma. So Sushruta mentioned this under parasurgical procedure. The importance of Agni Karma is Vyadhi now Punarbhava, so there will be less chances of recurrence of disease, or there will be no chances of recurrence. Next. So local management. So first we have to explain procedure to the patient. After that we have to palpate from neck region to elbow region. While during palpation we have to apply gentle pressure. At that time we have to mark most of the tender points. After that we have to clean with any antiseptic solution. Then we have to take Panchadhatu Shalaka and we have to make it into red hot. After that we have to give therapeutic shots at wherever the most pain is present. After that we have to apply Kumari Swarasa or Haridra Churna. So as Agni Karma is mentioned under Tvak, Sira, Snayu, Astigata Vyadhis, it is also Apavahuka is also one of the diseases which involves Sira, Snayu, Asti and Majja of the Bahu region. So Agni Karma is indicated in Apavahuka. Next. So because of its Tikshna, Sukshma properties, it enters into minute channels and it removes the obstruction because of Kapha which is present in the Amsa region. Automatically there will be restoration of the movements of the shoulder joint. And it also increases Datva Agni and increases blood circulation in that particular position. So after that, immediately there will be muscle relaxation and patient will restore his normal movements. Next slide. So conclusion. It is very economical and very safe procedure. It should be done at OPD level and it also increases time for hospitalization, and it can be done without any assistance of much members. Thank you.
We have a poster presentation now. I call upon Dr. Sunil Rana to present his poster.
Jhajar, UP. My poster presentation is Chaturveda Rakta Stambha Upaya, literally view. Rakta is known as Jivan. Rakta include in under Sapta Dhatu and mentioned as a fourth dosha. The share and vidridhi of Dhatu depend on Rakta. It has the potential for prana dharan and major role in development of various organs. Excess blood loss of body is fatal. It should be protected by all means. Hence, Rakta Stambhana Upaya should be adopted according to Shushrut Sthana 4th Adhyaya. Purpose of study to stop excessive bleeding by Chaturveda Upaya. Methodology. Sandhana Karm by 5 trees of chal. Plash, Udambar, Bargad, Peepal, Parish, Chal. संधान कर्म के बाद स्कंदन कर्म बाय कोल्ड थेरेपी बाय आइस एंड cold water, tap watering, normal tap water. And Pachan Karm by Spitika Bhasm, then Dahan Karm by wooden Shalaka and Panchadhatu Shalaka. Result Sandhan by Sitopchar, then not result given by Sandhan by Kashaya, then Pachan by Bhasm, then Dahan by Shalaka. Conclusion. Chaturveda Stambhan Upaya mentioned in our Sushruti Samhita are similar to hematemesis process. This upay used to rakta atisrav to stop bleeding. This four method use locally and internally. The most important thing is to remember that all bleeding must be stopped as soon as possible. So we use these four upayas. Thank you.
Presenters. Now I call upon our co-chair, Madam Dr. Lakshmi Ma'am, to conclude the session.
Professor from Dr. BRKR Government Ayurvedic College. And first of all, I want to congratulate the team of Swasthya, Dr. Satyanarayana Dornala and Fanishri and all the team who had conducted this Swasthya Expo, and it's really like rocking, I should say. And so coming to this session, and all the participants had done well. We have 8 participants in this session. Nagashrujana, Sachin Chandra, Soni Nigam, Uma Manta, and Priyanka from Dr. BRKR Government Ayurvedic College, Trupti from New Delhi All India Institute of Ayurveda, Sahiti from Vijayawada, and Sunil Rana from the UP. And really all the topics are really well done. I mean, regarding Nagashrujana topic, multi-dimensional therapeutic applications of Upanaha Sveda, it was really good. And Sachin has given all the census of Dr. BRKR Ayurvedic College Hospital, the research activities. And Soni Nigam, it was really, she did clinical and scientific perspective of Brahmana Nasya. Scientifically she produced how it is acting as a Brahmana. It's really very good. And Uma also presented conceptual analysis and importance of Dravya, Kalka Dravya and Niruha Vasti. And Vaitarna Vasti Chikitsa by the Priyanka. And Trupti has given the role of traditional medicine. Really it is, nowadays it is very important to implement this Kalari Chikitsa and Varmology in all the sports institutes. We need this actually. And Dr. Sahiti of Vijayawada has given the Agnikarma and Apabhaka really well. And Sunil Rana, it was a poster presentation. Actually, poster presentation, it's really, I mean, it's a bit different from all these 7 presentations. And all of them well, and Dr. Yashoda Madam will give the results within a short time. And I want to congratulate Dr. Sundarraj Perumal sir for a keynote address. Really sir, yours, lecture was very, it is a need of our today now. And I came to know about the sir recently. Sir conducted one Ayurveda Kaushalam at Vizag, Kodur village. Actually, I want to come to that session for 5 days. I missed that session. And sir told about the lifestyle disorders very well. And really it is, now we have seen that 40 million people are every year, as you said, are suffering with lifestyle disorders. And recently, Government of India also, they told that not to have cocktail in the medical seminars. And as a gynecologist, I see 20% of my gynec cases are of PCOD, polycystic ovarian disease, which is a lifestyle disorder. Daily in my OP, I give what to do, what not to do. Because nowadays, due to, shall I take some time? No problem, no? Okay. Due to lifestyle changing habits, these disorders has become very common. When I see my son also, he wake up in the night and he does work, he do work in the night and he sleeps in the daytime. What means he works in a software company and he has to follow that schedule. But he is forgetting to wake up in early in the morning. And so I think that it is the need of the hour to give knowledge to our children also and to everyone regarding this, what you told, that assessment chart and circadian rhythm. And daily we have to, follow the dinacharya, rutucharya. Now I remember the shloka from Charaka Samhita. Nityam hita ahara vihara sevi, samikshakari, vishaya asaktaha, data samaha, satyaparha, kshamavan, aptopasevi cha bhavatya arogaha. So those who follow this will be healthy, or otherwise will become unhealthy. So it is the need of the time to propagate and our lifestyle to everyone. And I congratulate Dr. Sundarraj Perumal sir for this session, sir. Thank you very much, sir, for giving this. And I congratulate all the team members of Swasthya, sir, once again. Really, this 3 days program is very nice. Okay, thank you very much for giving me this opportunity.
Good evening, all. Before going to announce the best presentation of today's session, and all the participants of this session, you all performed very well. The best presentation is Doctor name is Soni Nigam. The topic is clinical and scientific perspective of Brahmana Karma. Congratulations.
Thank you, ma'am. Now I call upon Dr. Sundarraj Perumal sir. I request Dr. Lakshmi ma'am and Dr. Yashoda ma'am to hand over the token of love to Dr. Sundarraj Perumal sir. Lakshmi ma'am to please accept the token of love from Dr. Yashoda ma'am and Dr. Sundarraj Perumal sir. Please accept the token of love. I request Dr. Johar sir to please hand over the token of love to Dr. Yashoda ma'am. Now I call upon Dr. Yashoda ma'am, Dr. Lakshmi ma'am, Dr. Sundarraj Perumal sir and Dr. Johar sir to please come on dais and hand over the certificates to the presenters. Dr. Uma Mantha, Dr. Priyanka P, I call upon all the participants to come over here for